Hello, I'm Ashley Lane, an occupational therapist, presenting my capstone project entitled Rehabilitation Practitioners and Climate Change, which was created while completing a capstone project with Sustainer Abilities. So this presentation is for rehabilitation practitioners, which includes occupational therapy practitioners, OTs and OTAs, physical therapy practitioners, PTs and PTAs, and speech language pathology practitioners, SLPs and SLPAs. So this presentation will cover these points. First, identify the health impacts caused by climate change, understand the carbon footprint of the healthcare sector, explore rehabilitation practitioners' roles in environmental responsibility, and then lastly, explore environmentally sustainable/responsible strategies to implement in your practice setting at the macro, meso, and micro level. So we'll first discuss climate change and its health impacts. So climate change is a currently occurring crisis affecting weather and climate extremes in every region of the globe. The primary cause is the accumulation of greenhouse gases from human activities, such as energy production, transportation, and industrial processes. The increase in global temperatures brought about by climate change causes an increase in extreme weathers, events such as hurricanes, droughts, and heat waves, which is depicted in the image to the left. As a result of these events, individuals and communities are at risk of acute food insecurity, reduced access to water, exposure to pollution, and extreme temperatures. So climate change impacts our health through direct causes, such as injury, illness, and even death, such as from extreme weather events or from extreme heat. There are also indirect effects, such as by affecting our ability to grow food. It affects the water we drink, the air we breathe, the distribution and behavior of insects, which carry infectious diseases, and affects the weather we experience. This image from the CBC depicts weather events in the center and how they impact the environment on the outer circle, and then the health impacts on the outermost section of the image. And I'll just go over a few of these sections. So extreme heat. An increase in daytime and nighttime temperatures are associated with heat-related illness, such as dehydration, heat stroke, and cardiovascular failure. Think about which of your clients or patients are most at risk of these health-related illnesses. So likely outdoor workers, student athletes, young children, those who have housing insecurities, and those with chronic illness and disabilities, such as individuals who have experienced a stroke, have MS, cardiovascular disease, diabetes, mental illness, or COPD, just to name a few. Air pollution, an increase in ground level and particulate matter, are associated with the prevalence of various lung and cardiovascular disease, which can lead to missed school days, hospitalization, and premature death. Again, some of your patients or clients are more at risk than others, such as children, older adults, outdoor workers, and those with asthma and other chronic lung diseases. Vector-borne diseases. Overall warmer temperatures are linked to an increased number of deer ticks, which transmit Lyme disease. The increased warmer temperatures lead to longer seasons of risk and higher rates of infection. And then lastly, I'll mention mental stress that can be experienced following flooding events, which can cause substantial health impacts, including sleeplessness, anxiety, depression, and PTSD. Additionally, drought has been identified as a slow-moving stressor that contributes to acute and chronic mental health conditions. Again, these are just a few ways the effects of climate change are impacting human health. For additional resources, you can find the link below on this presentation. It provides you a link to the PowerPoint. Throughout the PowerPoint, there are links throughout, as you can see at the top of the slide. So some groups of people, as I've already discussed, are more at risk than others to health risks from climate change. This list is not all inclusive, but are some of the most at risk, which include children, BIPOC communities, older adults, people with chronic conditions, people with disabilities, outdoor workers, and those that experience housing insecurities. There are three factors that contribute to vulnerability, which are sensitivity, so the degree to which someone is affected by a stressor, such as extreme temperatures, and then exposure, so physical contact between a person and stressor, such as an outdoor worker exposed to extreme heat, and adaptive capacity, so the ability to adjust or avoid potential hazard, such as being able to afford to pay for the electricity to run the air conditioner during times of extreme heat. Not only are certain populations more at risk to climate crisis, so are healthcare facilities, but the healthcare sector also contributes to an increase in greenhouse gas emissions, which I'll discuss next. If the global healthcare sector were a country, it would be the 5th largest emitter of greenhouse gases. In the United States, the healthcare industry produces 9 to 10% of greenhouse gas emissions. A large portion of these emissions are generated from the manufacturing and procurement of medical supplies, most of which are disposable. We are stuck in this paradox by the healthcare system we work in is inadvertently doing harm in the communities where we serve. Additionally, our healthcare systems are highly vulnerable to the impacts of climate-related disasters, such as hurricanes and wildfires, which in turn leads to cascading impacts on the health of those affected and the affected communities. So now I'll specifically focus on rehabilitation practitioners and how it relates to your professional practice. To start with occupational therapy, the environment is a fundamental part of OT practice. The OT practice framework describes occupation as occurring within a context that includes the natural environment and human-made changes to the environment, which includes climate change. The World Federation of Occupational Therapists have put out a position statement encouraging national and regional organizations to advocate for public policies and research that contributes to effective interventions to mitigate climate change, develop curricula that promote sustainability practices, and collaborate with other health professionals on education strategies. One national association, the American Occupational Therapy Association, AOTA, is slowly starting to take some of these actions through a published policy statement, which was released in 2022, articulating OT's role and the profession's scope of practice in addressing climate change and how it impacts clients. As human-driven climate change continues to threaten ecological systems and occupational participation, OTPs are ethically obligated to address this global issue by providing sustainable healthcare, education, and research without harm to the ecosystem. Moving on to physical therapy. Physical therapy plays a vital role in addressing climate change by emphasizing preventative care, reducing health inequalities, and improving patient and public health. The World Physiotherapy published a policy statement which recognizes climate change as a global emergency that is impacting human health and well-being. It acknowledges physical therapists should be aware and take action to reduce the profession's greenhouse gas emissions to protect the health of its patients. And then the American Physical Therapy Association put out a statement supporting environmental stewardship to increase awareness of the effects the environment has on patients, movement, health, and safety. Moving on to speech-language pathology. When looking at the scope of practice for speech-language pathologists, prevention and wellness are included. which involves reducing the incidence of a new disorder or disease, and involvement is directed towards individuals who are vulnerable or at risk for limited participation in communication, hearing, feeding, and swallowing related abilities. This may be done through environmental changes, such as modifying the environment to decrease risk. Additionally, advocacy and outreach is also part of SLP's scope of practice when it comes to advocating for individuals through community awareness, prevention activities, education, and political action. Some acknowledgement of the health effects of climate change on patients has been made by SLPs, such as the role air pollution, heat waves, and infectious diseases play in the development and worsening of communication and swallowing disorders. This graph on the right depicts how climate change can increase the risk of disorders, diseases, and other complications. So now that you've learned about how climate change is impacting the health of patients, how the healthcare sector is contributing to climate change, and how rehabilitation associations are responding, I'm now going to transition to what actions occupational therapy, physical therapy, and speech-language pathology practitioners can take and implement into their practice to become climate-conscious practitioners. So to effectively mitigate the health effects of climate change, the health sector needs to reduce its greenhouse gas emissions and implement systemic changes in clinics, schools, and hospitals, while also improving client health outcomes. So this graph on the right was modified from Mortimer and Paulston et al., which breaks down the action steps needed to achieve the overall outcome to reduce greenhouse gas emissions, while without reducing the health outcomes. So the primary drivers being reduce healthcare activity and then reduce greenhouse gas intensity. And then the secondary drivers being prevention, client empowerment, lean pathways, low carbon alternatives, and then operational resource use. And I'll go over each of these secondary drivers with examples in the following slides. So to begin with the first secondary driver, prevention. So examples of prevention would be to address social determinants of health, to prevent illness and promote health. So an example of this would be to apply for grants that address environmental and human health impacts related to climate change. Another example would be introducing green interventions that can be continued after treatment, such as gardening and growing your own food or active transportation. This could also be as simple as completing outdoor crafts using natural items. The next secondary driver is client empowerment, which can include client education on the health impacts of climate change and how it is affecting them and how to monitor and prevent adverse health effects, such as by checking the air quality in the air before engaging in outdoor occupations. Another example of client empowerment would be modeling environmentally responsible occupations that also provide therapeutic benefits, such as hanging laundry to dry to work on coordination and balance, or practicing looking up specific books at the library to work on various cognition skills. Moving on to lean pathways. Examples of lean pathways would be to advocate for rehabilitation therapy as a preventative measure for hospital readmission, as well as advocating for our services compared to more environmentally costly interventions and prescriptions. Additionally, advocate for more community-based services compared to institutions. Next, low carbon alternatives, such as utilizing telehealth when appropriate to reduce greenhouse gas emissions, or purchasing products with third-party certifications that are made with higher quality products or use less resources to produce, such as Certified B Corporation or Global Organic Textile Standards. For a longer list of certifications that can be accessed via the link below. And then lastly, I'll discuss operational resource use. But I would like to point out, as rehabilitation practitioners, it is not your sole responsibility to reduce the greenhouse gas emissions created by your corporate employer. These last few points I will discuss are advocacy efforts that can be taken to initiate change at the mesa level. Such as by implementing a green committee at your place of employment. There's a handout with steps and suggestions on how to do that, such as remembering to focus on the co-benefits of implementing environmental responsible strategies, such as the financial benefits to win over the corporate agenda. And then these are other advocacy engagement opportunities, such as joining an organization, such as Sustain Our Abilities. And then at the micro level, client action steps include bringing awareness to these issues by talking to coworkers about climate change and its health impacts, or educating yourself on the climate crisis via these documentaries, and then calculating your carbon footprint as another way to gain education on this issue. Additional action steps that can be taken at the micro level, such as energy efficiency measures, which are mentioned on this slide, or waste reduction measures, such as repurposing thermoplastics or orthosis in hand therapy. And then these are the last action steps that can be taken at the micro level. So resource procurement, such as obtaining used or secondhand DME. Again, all the links throughout this presentation can be accessed via the PowerPoint provided below. And then lastly, I'd like to point out, when you as a rehabilitation practitioner are making climate conscious actions in your workplace, what is the impact those actions have compared to the amount of effort? So in this graph, you see that the x-axis is the level of impact, and the y-axis is the amount of effort. So one example being checking out a library book at your local library. If this is something you and your patients have access to, has a small impact. Compared that to reducing your meat consumption, can have a much larger impact compared to initiating your own green committee at your workplace. Can have an even bigger impact in reducing greenhouse gas emissions. And then these are my references. And I'd like to thank you very much for listening to this presentation on rehabilitation practitioners and climate change. If you have any questions or comments, please feel free to reach out. I have left my email address on this slide. And again, to access this presentation and the links provided throughout, the link is posted below.